गुड इवनिंग लेडीज़ एंड जेंटलमैन। स्वागत अभिनंदन आप सभी का एक बार फिर से NABH QCI की ओर से। सुबह से लेकर पूरे दिन की चर्चाओं के बाद ये स्पेशल हमारा एक इवनिंग का जो है सेगमेंट है, उसकी हम शुरुआत करने जा रहे हैं। और ये बहुत खुशी हमें होती है NABH को और QCI को कि हमारे सोसाइटी से, डिफरेंट सेक्टर से, और आज हम हेल्थ सेक्टर को लेकर जो बात कर रहे हैं उसमें डिजिटल हेल्थ स्टैंडर्ड्स को लेकर जिस तरह से बहुत सारे हॉस्पिटल्स हमारे साथ खड़े होते हैं, उनकी भी अपनी एक इनिशिएटिव, एक अपनी तरफ से एक प्रयास होता है। और इससे हमें बहुत विश्वास होता है कि बहुत जल्द जो सिचुएशंस हैं वो स्टैंडर्ड्स के हिसाब से बहुत ही फेवरेबल होंगी। इंटरनेशनल स्टैंडर्ड्स के हिसाब से भी जो सस्टेनेबल डेवलपमेंट गोल एक WHO ने तय किया है, उसके हिसाब से भी हेल्थ सेक्टर में, और भारत सरकार के जो अपनी प्लान्स और अपने जो गाइडलाइंस है उसके हिसाब से भी। तो इस बात से हम सबका बहुत हौसला बढ़ता है। सो बिफोर वी स्टार्ट दिस सेशन ऑन नवोदया इज गोइंग टू बी अ सेशन हियर ड्यूरिंग दिस इवनिंग इवेंट, और इसमें हम जो बातचीत करेंगे वो NABH लीडिंग द वे इन हेल्थ केयर इनोवेशन। बहुत कुछ इनोवेशंस हो रहे हैं और वो बहुत यूज़फुल है, एफिशिएंसी के हिसाब से, ट्रांसपेरेंसी के हिसाब से, जो डिलीवरी है हमारी सर्विसेज की उसके हिसाब से, उसमें बहुत सारी उसके पॉजिटिव जो हमें बेनिफिट मिलता है। तो इस सेशन को, इस इवनिंग को हम स्टार्ट करें। बिफोर दैट आई विल इन्वाइट डॉक्टर अतुल मोहन कोचर, CEO NABH, फॉर सेटिंग द कंटेस्ट। डॉक्टर अतुल मोहन कोचर सर, I will request you to please be on stage just to start the evening and set the context for this evening. Dr. Atul Mohan Kochar.
Thank you so much. Good afternoon, good evening, good evening. It's my proud privilege to welcome all of you distinguished people to this evening of felicitation. Last year, on exactly the same date, 17th of September, we released the NABH Digital Health Standards. And frankly, we were not aware what is digital or what is exactly the relation and context to digital health. Each one, we were the 6 blind men in a room, each one with a different interpretation. But under the guidance of now our chairperson, Mr. Rizwan Koita, we have achieved lots of clarity. And we also announced that we would run an early adopters program, and the first 100 hospitals, there were so many benefits. Of course, we ended up extended the fee benefit. There was a 50% fee waiver, etc., etc. But I think that stimulus caught on, and the first early adopters, we agreed, and we are very proud and privileged to have those first 100 hospitals here with us. I think we can have a round of applause for all of us. Not only that, today it's my privilege to announce that we have 275 applications. And while we agree that we only opened this specific standard for already accredited HCOs and small healthcare organizations, we are now coming up with a huge plan to take it to the smaller facilities countrywide. So, but it is your day today, and you have done it. You have worked very hard to do what is probably the first digital health standard in the country, or probably the world. And I think I have no words. And to set the context in a larger frame, we have a very special session by 7 distinguished people, moderated by none other than our chairperson, Mr. Rizwan Koita. I invite all of you. Janendra ji? Yeah. So this is about your guidance, your suggestions. Today, to expand the people who were not here in the morning, we announced a series of measures and series of new standards. One of them is NABH standards for EMR and HIS systems. That also a revelation for us. That's also a huge learning curve for all of us. And I'm sure once you start to download this booklet, which will be available online tonight, you will find lots of meaningful things to understand, to improve your own concepts of digital health, softwares, and I can unhesitatingly say what it has done for all of us. Every hospital needs the foundation of a digital to give their optimum I can also say that to improve their outcomes, you need database, analytical decision making, and these standards help you do just that. So please do download these standards. Please encourage your colleagues, your other branches to download these standards, and there's lots of good sense in them. And in case you find challenges which are not implementable, which you find are impenetrable, or you find that they are difficult, please do send in your suggestions. Though we have 3 maturity levels under the digital health standards of the platinum, gold and silver, and all of you are representing, many of you are representing either of these 3 standards. For the HIS and EMR standards, we have again 2 levels of maturity level, which is basic and advanced. But please really review these things, because the next frontier is how you can use these optimum tools. And there are many of our colleagues from the EMR industry, from the HIS systems, who have contributed to these standards, who understand these systems, and I'm sure going forward they will work in tandem with the products which they have to bring more clarity to what you need to give yourself the best. Over to you, Janendra ji, for this thing. Thank you so much for joining today.
Thank you, Dr. Atul Kochar, CEO, NABH. And now we are going to start the session on Navodaya. NABH leading the way in the healthcare innovation. आप जानते हैं कि डिजिटल ट्रांसफॉर्मेशन हेल्थ सेक्टर में जिस तरह से उसने जगह बनाई है, और उसकी वजह से कितनी सारी चीज़ें जो हैं वो प्रैक्टिकली ग्राउंड पर हो पा रही हैं, आसान हुई हैं. इसी तरह से इनोवेशन बहुत बड़ा एक फैक्टर है जिसमें इस बात से बहुत मदद मिलती है. एंड वी होप एंड वी बिलीव QCI और NABH के साथ आपकी एक्टिव पार्टिसिपेशन, आपका कंट्रीब्यूशन इस मिशन को बहुत आगे तक, ग्रास रूट लेवल तक लेकर जाएगा. In this continuation, we are going to invite the panelists of the session, this session, special session. And first of all, I will invite Shri Rizwan Koita Sahab, Chairperson NABH, who is going to moderate this session. Please welcome him with a huge round of applause, ladies and gentlemen. Shri Rizwan Koita. And the panelists in this session are Chairman and Managing Director, KIMS Group of Hospitals, Dr. B. Bhaskar. I will request him to please come on stage and take his seat. We are privileged to have the former MD, Pfizer Healthcare India Private Limited, Dr. C.B. Rao. I will be requesting him to please come on stage and take his seat. Then we have Srimati Hemgauri Bhandari ji, Chief Advisor, Quality Council of India. She will be part of this panel. And Dr. Vaibhav Kapoor, co-founder, Pristyn Care. Dr. Vaibhav Kapoor. Next is Shri Ravinder Singh, SPPP Consulting, CitiusTech. I will be requesting Ravinder ji to please come on stage and take his seat. And also Aditya, Patkar Sahab, entrepreneur, digital health expert, co-founder, Plus 91. So I will be requesting Mr. Aditya also to come on stage. And the CEO, Art Park at IISC, Shri Raghu Dharmaraju. I will request him to please come on stage. और एक बार मैं फिर से रिक्वेस्ट करूँगा ऑनरेबल सेक्रेटरी जनरल QCI चक्रवर्ती टी कन्नन जी से एंड डॉक्टर अतुल मोहन कोचर, हमारे CEO NABH, की वो स्टेज पर आएँ और हमारे इन पैनलिस्ट को एक प्लांट भेंट करके सबको वेलकम, सबका अभिनंदन करें इस मौके पर. ये सभी अपनी फील्ड के वो एक्सपर्ट्स हैं जिनका लंबा अनुभव है इस फील्ड में. इनोवेशन हो, टेक्नोलॉजी ट्रांसफॉर्मेशन हो, डिजिटल ट्रांसफॉर्मेशन जिस तरह से उन्होंने अपनाया है, तो इन सबको एक एक करके यहाँ पर okay, then we will have a photograph, group photograph first, and then after that we will be felicitating the dignitaries and panelists. So just during this time, I would like to share with you about these panelists. Mr. Rizwan Koita Sahab, the chairperson of NABH and co-founder of CitiusTech, is a very prominent entrepreneur and philanthropist focused on advancing digital health through Koita Foundation. एक बार सबके लिए आपकी तालियां ज़रूर बजनी चाहिए, सभी को वेलकम हम ज़रूर करें. और जब ग्रुप फोटोग्राफ हो रही हो, ऐसी तालियां विद फुल ऑफ एनर्जी बजती हैं तो बहुत अच्छा फील होता है, खुशी आती है और वो खुशी चेहरे पर भी झलकती है. Mr. Rizwan Koita holds degree from IIT Bombay and MIT and has received prestigious awards including IIT Bombay's Distinguished Alumni Award, और इधर से शुरुआत हुई है हमारे जो पैनलिस्ट हैं, डॉक्टर बी भास्कर राव, Chairman and Managing Director of KIMS Hospitals, very renowned cardiothoracic surgeon who founded KIMS in 2004. Then we have in this panel Dr. C.B. Rao, with over 50 years of leadership experience in the field. We welcome him. And Hemgauri Bhandari ji, Chief Advisor to Quality Council of India, extensive experience from roles at Prebo Automotive and Bosch. She is here with us. Dr. Vaibhav Kapoor, co-founder of Pristyn Care. He is part of this panel and has driven the growth of the $1.4 billion healthcare startup, which boasts over 1,000 partner hospitals and 500 doctors. He is an award-winning surgeon, very renowned surgeon. Then we also have Ravinder Singh ji, and in this panel we have Aditya Patkar ji, Raghu Dharmaraju ji. इन सब का हम बहुत बहुत स्वागत, बहुत बहुत अभिनंदन करते हैं इस पैनल में शामिल होने के लिए। NABH के इनविटेशन पर QCI के इस इवेंट में आप सबकी मौजूदगी के लिए, एंड जस्ट वी आर वेरी कीन टू लिसन टू फ्रॉम दीज पैनलिस्ट. सो आई विल रिक्वेस्ट Rizwan Koita sir to start the proceedings.
Hello, can you hear me? So first of all, good evening everyone. Quite a pleasure to see all of you all here. As Dr. Atul mentioned, when we started thinking about the standard 2 years back, it seemed like quite a distant dream, and it is so gratifying to see not only the standards getting rolled out last year, but now getting a chance to felicitate 100 of the first 100 hospitals who have gone through the certification process. Today's session, the evening session, is slightly special for us because in some ways, almost everybody in the audience is actually a friend and a big supporter of NABH. You all are all largely from hospitals who have already gone through the accreditation process. And there are also hospitals who have taken the effort of stepping out and becoming sort of open to trying out a new standard in digital health. So thank you very much for that. And what we want to do in the panel today is almost think of the morning session we did as a public session. This is sort of a little bit more of a private session where we have folks from various different backgrounds on the panel. And I'm going to go around and I'm going to request everybody keep their opening remarks to no more than 2 or 3 minutes. Let's keep it quick so that we can have more discussion around that as well. And the question that I'm going to ask them is that as they look at NABH from the outside, okay, and many of them sort of all have a very deep association with NABH, but they're still in some ways, looking at from the outside. What is it that they would like NABH to do to evolve or to do more of over the course of the next, say, 5 to 10 years? And not necessarily limited only to digital. It could be other areas and suggestions that they may have. And we have the NABH team, which is ready to make some frantic notes based on the ideas and suggestions. And then hopefully amongst all the different things that we are trying to do, we will incorporate these ideas and suggestions too. So this is much more around the NABH team hearing, and we have the QCI leadership here as well, hearing from some of the experts on the panel in terms of what are their views and ideas about what NABH ought to be doing, and taking it forward from there. Yeah. So maybe I'm just going to go around, and I'm going to start with Dr. B.B. Rao. And again, as I said, I'll just request each one of us to limit our comments, the initial set of comments, to about 3 minutes. That would be fantastic. Yeah. So over to you, Dr. Rao.
Thank you, sir. Thank you very much for giving me this opportunity. And first, let me congratulate the NABH. When there was nothing about a couple of decades back, now we have come to a stage where there is a lot of accreditation has come. One important thing NABH has achieved in 1 year, 100 hospitals got the digital health. That means whatever they are saying, that they could be able to do it. That means there is a lot of confidence on the quality conscious by the hospitals and the board. What I suggest for in future for the NABH needs to develop a lot more things. We are doing now an accreditation of the hospitals, but we are bringing a lot of people in different areas and constructing the hospital, and we are accreditation of that one. If you want to really improve further and make it holistically a good quality care, we need to be able to look into the stakeholders of this hospital. Mainly the stakeholders of the hospitals is, one most important person is the patient, the The second important person is the human resources. Third one is the infrastructure and the accreditation. So as far as the patient is concerned, you want a good safety. The safety will not just come by putting all the things as such. You need to, human resources will be well trained. Today, if you are taking doctors, there are many people who graduated about 4 or 5 decades back. If they want to go for digital health and all those things, may not able to perform. But if you are able to train the doctors during the education period itself in the medical college itself, how we need to be able to document, we are able to do, and that has to be done. Like hospitals, we also need to do accreditation to the doctors also. There are many countries, they do accreditation every 5 years. They update their skills, and then new therapies that has come, how they are able to perform and all those things. Similarly, the nursing, the pharmacy, the physiotherapists, everyone has to be accredited during their education period itself, and they are all well trained before coming into the hospital. The second important thing, once the hospital comes, infrastructure, as we all discussed in the morning, there is a lot more things which we are able to do when we are incorporating in the building. If you look into that, there is no hospital was existing about a decade back beyond 30 meters height. That was the situation in this country. Now we need to be able to change. If you look into that, hardly about 10 hospitals in the entire country has more than 30 meters. Now that is 60 meters. Now I created that, a special GO in Andhra Pradesh to build a 60-meter site. There is a lot of havoc has been involved in that from the government side to do all those things. And now National Building Code has come and given up to 45 meters. Beyond 45 meters, you need to be able to look into the state governments. Again, the fire system, and we are doing those things. If an 18-story building, you need to create a ramp. It was a must at that time. Then I need to put a lot more efforts to remove the ramp, because when you create a ramp, they always think that ramp is the easiest way of transporting when fire occurs. Mostly, it is not due to fire the patients will lose the patients. It is because of the smoke, where there is a ramp. If a patient is transferred from 18th floor to the ground floor, patient will die by the time it will come back. So we need to be able to identify what are all the critical masses that has to be done. This has to be done by the NABH, and they are able to look into all those, provide a good sort of a policy systems, so that across the country they will be able to do much better. Like even in insurance, like what we are discussing in the afternoon session, even if the patient is discharged, about to discharge, it is a cash patient, he has to wait another 6-7 hours in the hospital. That itself also comes under the quality. Like that, there are so many issues that will be there. It is not only putting the systems and processes. If you can able to develop and train all of them up to the mark, including the class 4 employees, the patient quality will be able to go, because the GDA is not up to the mark. When we are able to train all these people, and then if you are able to go for the accreditation, I'm sure the NABH will be able to is doing one of the best things which I have seen, because I have 15 hospitals. All of them are being accredited by the NABH. With that, the sea change will be there in the form of human resources, in the form of the management and other things. So there is a lot more we can able to do. I'm sure the NABH will be able to work it out. One good important thing in this organization is they are almost like a teachers. Whenever they come, they will teach, they will train, they will be able to send the remarks, and then it is able to recruit. Like unlike another government organizations, when they want to scold also, they will scold. Before scolding, they will send a email that I am going to scold for you people, so that people will get rectify themselves. In which way, I think NABH is doing a wonderful job. What I suggested about these human resources, accreditation of the doctors, nurses, physiotherapists, everybody, the quality care will improve. And also how a management also facing problems like insurance, the patients will come back and scold the management. Even though the degrees has been awarded by different universities, They're all coming and working. If something goes wrong, they don't go to the doctors, they don't go to the nurses, they don't go to the physiotherapists. They only come and find with the management of the organizations. I, being a doctor, as a cardiac surgeon, as a management of 15 hospitals, these are the few important things where NABH can able to take.
All right, thank you very much, Dr. Rao. I'm going to pass it out to Dr. C.B. Rao to share his views based on his experience at Hospira, which is now Pfizer Healthcare India. Yeah.
Good evening, everyone. It is a great conference, obviously, and the participation is extremely heartening. So kudos to QCI and NABH for doing. Although we have had many certifying institutions, regulatory institutions, I think NABH stands out unique because of the two-way association. NABH is associated with the hospitals, and hospitals also would like to be accredited, go through the rigorous process and get accredited by NABH, which is a very healthy sign. So in line with what Mr. Rizwan asked and what Dr. Bhaskar Rao talked about earlier, I think NABH can continue to play a major role. Today being a digital standards, digital healthcare event at this point, I would suggest that the opportunity to replicate what digital has done for commerce could be something we could think of. What did digital do for commerce? It created a universal marketplace. And that universal marketplace meant that you can reach out to any country for any product and you get delivered. And that was the concept, and that is working very well. And Government of India also has taken several initiatives in that in terms of NCPI, ONDC, etc. Now, NABH can take the initiative to create a completely universal, accessible, affordable digital healthcare ecosystem, taking the initiative further, and probably that is something which all of us can deliberate on, and I'm sure NABH will come up with very creative ways to do that. But at the same time, there is this important issue that healthcare cannot be only digital. We have to feel the patient. Doctors have to feel the patient, and patient has to feel the doctor. Care, compassion, attention, and what arises out of seeing the patient is important. But if you ask ourselves, are the doctors able to devote the appropriate amount of time to the patients, because the patient flow is so huge in any hospital, right from public healthcare system to corporate hospital system. So how do you make this happen? And solution is not only building more hospitals. Coming from a manufacturing and R&D background, when we have demand problem, we don't say that build another factory. We do build factory, but for 5 years hence. So what do? We enhance capacity utilization, we digitize, we make sure that things go properly. And that's where probably the new way of digitization, new way of artificial intelligence can help in making the, for want of any better word, hospital floor much more productive, much more helpful, and everyone's time is appropriately done. And also, as we all know, artificial intelligence can come up with whole thing. If a patient has come for 10 X-rays in the past, it can give a complete readout of what happened in the past. If somebody has a cyst and 3-4 scans have been done, a readout has been done how the profile has changed over time, and so many things can be done. But making the patient-doctor interaction much more productive, much more helpful is something which digitization can do. And apart from that, probably digitization will help us to be free. It is not just the slot. You are available 24/7 in some manner or the other, although it may be looked at some point of time later. So that kind of transformation in healthcare system, and everyone networked. It is not just one hospital versus another hospital, one specialty versus another specialty. Everything is available for everyone. And if that happens, then the true digitization impact will be felt, and India would be a very healthy nation and a very prosperous nation therefore too.
Thank you very much. I think the broad point you're making is we really need to think about digital in a much more broader manner at NABH, which will be helpful to the hospitals. Thank you very much for that. Hema ma'am, your thoughts, comments? Yes, please.
Yeah, good evening to all. And maybe Mr. Bhaskar Rao, I would second you so much on the thoughts that he just mentioned on how do we, if there is a higher patient inflow, how do we increase more on the productivity part of it. So I also come from a similar background and thought process that how do we make our services more efficient, more simpler, more faster to reach to the last mile. And technology and innovation fairly are, in today's scenario, we see that there has been huge developments on the technology front. So there is not much that we want to invent newly. I guess there are a lot of products and solutions already existing. What we want to see here in India is more to imbibe these on a faster pace. And from QCI and NABH, I would like to see how we can facilitate it more faster and a better stream. Also, the other part that, we want to bring the system to people. And today what we are trying to gather is the inputs from the people to see how to improvise the system more better. So in that endeavor, at the NABH side, we are also trying to fairly evolve our systems and processes in a much efficient way to see that it reaches at a faster speed to the last consumer. So I think I would like to stress more upon the part that how we improvise on our internal processes and standards to make it more efficient and faster.
Thank you very much, Hema ma'am. I'm going to now pass it on to Vaibhav. I think he leads one of the most happening companies, which is kind of almost redefining how healthcare service delivery needs to happen. And he's also associated, Pristyn is also associated with NABH in a couple of different ways. So over to you.
Thank you, everyone. The topic is healthcare innovation. I'll put it in a manner, over last 7-8 years, there's been a lot of startups who've started to do various things in healthcare, whether it is e-pharmacy side, whether it is, healthcare side, IPD side, EMR side. The important thing also is, while all of us want innovation, but, we are also skeptical, whether all these startups are doing the right thing or not, right? So in general, we're not very supportive of, what is happening around, and especially, when a few of these startups grow up, when they become more visible, whether they've raised funds, whether their business is growing, I think the worth is even more there, right? So we, as Pristyn, we have gone through this struggle of ours as well, and hence that was the time when we also reached out to NABH, and Dr. Atul sir has been really, really supportive, in sort of showcasing us also everywhere, and giving us platform to also give our viewpoint. So what I feel is, typically NABH can play a very important role in a way to sort of, take all these startups in their loop, create a sandbox, and then create, a code of conduct for these. So for example, when we started, we first made a code of conduct for ourselves, right? But we were not a hospital, so what we follow, right? Then a couple of other startups, started doing same thing. Then we formed a code of conduct together, right? We went to Niti Aayog and we said, okay, let us make a code of conduct for new age healthcare models. And that's when I think the moment is ripe that, we come under NABH umbrella, and for all these startups, at least a version 1 of code of conducts are made, right? So that, at least those are followed, and over the period of next 5-7 years, these will eventually evolve, because everyone is just experimenting and, taking it ahead. So I feel NABH can play a very important role, because when a startup says, okay, we are under the umbrella of NABH and they are closely monitoring us, it's also sort of validation, in front of a lot of, healthcare service providers that, okay, they are doing the right thing. Of course, they are trying to experiment, but they're still under a controlled manner, patient safety being paramount, and they're experimenting. So they're a sandbox. So insurance, IRD has created this wonderful sandbox where, new age healthcare companies can, come in there and, they can try out different things in a controlled pilot and all. So I think that will really help new age healthcare models to grow. Second, I feel, like Dr. Bhaskar also said, in today's time, it's not just about the safety. See, safety in healthcare is paramount, right? It's a given. If I am getting admitted, I would want best surgical, best IPD care to happen. Today, people expect not just safety, but also a lot more convenience. Thanks to 10 years of innovation, Swiggy, Zomato, Amazon, everybody is now looking at convenience as well, right? Gone are the days where, I think 90% of the people here would either use a Ola or Uber. Nobody goes to the taxi stand now. 90% of them would probably be doing a Zepto or a Blinkit. So everybody is also looking at convenience, right? So especially when a patient is going for a surgery, it's not just the patient, the entire family is involved, right? At least, all the primary members take leaves, and they expect a lot of convenience when they are going to a hospital and when they are paying, right? So NABH standards, I missed the morning session, but when you spoke about NABH standards for HIS, NABH standards for EMR, similarly NABH standards for, pre-surgical care, right? Patients wait for hours and hours in OPDs, hours and hours for admission, hours and hours for, discharges. So typically laying down NABH standards for them, would really be helpful, and one of the reasons why new age healthcare prosper is because they also look at all this convenience part as well. Yeah.
Thank you very much. I think your idea about how do we create a supportive ecosystem for startups is a very interesting one. Thanks for that. Ravinder leads consulting for CitiusTech and works with healthcare organizations around the world. So would love to get your point of view as well, Ravinder.
Thank you, Rizwan. And as you mentioned, I'll take an outside-in perspective and also from a healthcare informatics standpoint. Some of the learnings that we have seen across the world, and given that we are not today talking about the digital healthcare standards, this is a cusp at which I think digitization is starting to take off. So if I really look at NABH, there's a very unique position that NABH has today, which is access to standards, or rather creator of standards, very high touch access to providers, very high touch access to even now insurance with the health exchange, access to ABDM. And I think these are all different ingredients that we need to create a health informatics as a platform. And that essentially is again a catalyst for innovation in healthcare. For example, the colleagues just mentioned about, for example, we spoke a lot about safety. What is the right benchmark for safety? What is the right level of training? We spoke a lot about training that is required for nurses, training that is required for diagnostic staff. What's the right level of training that is available? We don't have those benchmarks. How can we systematically collect this data, whether this is service standards, whether this is clinical standards, and can we actually create these as benchmarks? And as we systematically start collecting this data, it's a very high fidelity data, which also allows us to then democratize it to create more innovation for startups, which essentially can, again, give us, whether it is AI machine learning, whether it is actually population health insights, all of that actually feeds back into the system in making the system better. So I believe one of the areas that NABH can really think about is how can it actually play a bridge role between all of these different elements that are available today with us, bring them together and start creating a kind of a condition for health informatics in India.
I think just to summarize, I think that's a great point. We've had some internal discussions around this as well, that if you look across the length and breadth of the country, NABH is so uniquely positioned in terms of the kind of data that it is collecting, and if we could just work on that and be able to better analyze that, then that would be great. So we'll come back to that in a moment, Ravinder.
Correct.
So, yeah.
If I may just add one point, I think one of the areas that also happens when we work with standards is that translation of those standards into practical aspects. For example, we have very good standards and guidelines around consent, but have you really translated into saying that are there options for data donation that is available today while we are actually touching the hospitals? And is that a foundation for us? I think those translations, if we can put in place, that will be a big enabler and boost, because those are barriers for people to interpret and take very baby steps or skeptical steps as, towards, these kind of areas. So I think those are some of the barriers, if can be removed, can be a great starting point.
Got it. Wonderful. I'm going to now pass it on to Aditya. Aditya heads, one of the larger EMR companies, and plus 91, and they've been very helpful to us even as we were looking at validating some of the EMR HIS standards. So thank you very much for that, Aditya. So over to you, Aditya, for your thoughts.
Thank you, Rizwan, and good evening to all. I find that, I think everyone here agrees that healthcare is a very personal experience, can also be a very painful experience, not just for the patients, but their families. And keeping in line with what today's conference, in the morning session especially, was about patient safety, I think that we have all just scratched the surface of providing actual patient safety in hospitals. There is a tremendous room for improvement. Patients, come to the hospital expecting, obviously, them to be treated, but do not want to fall deeper into a hole, right? And errors, negligence, or non-adherence to workflows is still a major problem, not just in India, but across the world. Some of the statistics, especially in the US, just on medication errors is tremendous. And I think NABH can play a very, very vital role in strengthening patient safety, not just using digital media, but also, workflows, as well as standards related to reporting, right? A lot of things get missed out because there is not enough reporting done of the kind of issues happening inside hospitals, and hence they are never solved, or they're solved very late. I think that's an area where NABH can focus in the future, and obviously I think everyone here would love to be part of it, given the amount of impact it will create for everybody in the healthcare ecosystem. Thanks. Thank you.
Yeah, thank you very much, Aditya. We actually had a lot of discussion on patient safety this morning, which was one of the prime focus areas, but your thoughts are very welcome. I'll pass it on to Raghu now. Raghu runs a very interesting organization called Art Park. I would make an assumption that not many of you all have heard of it, because it's a very specialized analytics and AI entity inside of IISc Bangalore, but they do some really amazing work. So he looks at very large data sets in healthcare, and then they try and figure out what the trends are and all of that. So brings a very unique perspective to the discussion. So over to you, Raghu. Yeah.
Sure. Thank you so much for having me here. Before we got on the stage, Rizwan was asking me how familiar I was with NABH, and I said not much. But by the time folks spoke from there to here, I feel like I've learned a lot. So now I'm a little bit better prepared. So thanks for putting me last, right? See, what I see when I look at this room and after hearing all of you is you should absolutely be at the frontiers of innovation in healthcare in the world. Because innovation in healthcare is, and even biology, is now all about data, right? It's not just about AlphaGo, it is about AlphaFold, right? That's who solved the protein folding problem, right? Biology, someone used to joke, biology is too important to be left to doctors alone, right? So I think you need us folks to work with you closely. And all of you talked about bioinformatics. The way we think about it is how do we really bring AI innovations to solve for India as well as for the world? But getting excited about AI is like getting excited about cars. Before we know what performance and safety we are okay to put it on the road, without knowing what the parts or the assembly lines are, and without having the supply chains. And in here, no one is better prepared to solve this than basically the leaders of healthcare industry essentially here. And NABH is doing an amazing service by bringing in the base level digitization, without which all this would be a total pipe dream, But this is base level, right? It's not about quantum of data, it is about the quality of data, right? That's where we are working with the Indian Council of Medical Research. It's a nascent initiative. I invite you all to participate in it. The idea is you want population scale insights, certain quality of data at the individual level is okay, right? Because you are just trying to understand broad trends. Next level is your hospital system level insights. But if you really want to build generalizable AI for individual screening, diagnostics, treatment, what is necessary from that data, our hospitals, even you, would have to truly leapfrog. Because gold is running through your veins. How do you mine it, right? And that's essentially what we are doing. We are bringing together a set of standards to first actually define in a use case centered manner, what do we even mean by gold standard data sets, right? If company X comes to the table and say, I have this algorithm, do you have a way of validating? And do we then all use the same test to validate or not? Without benchmark data sets, how do we do that, right? So if Fortis and Apollo are next to each other and they're using two different algorithms for the same thing, and tomorrow the patient brings some sort of litigation, saying, I got a result X here, result Y here, two different AI algorithms, how are you going to deal with it? So there's a dire need for you, the champions of healthcare, to participate and work with, we are a non-profit organization with basically the mandate of working across government and non-profits, research academia, and industry and startups to do this, right? So I'll just leave it there. We can dig deeper into what types of AI and all that sort of stuff, but this is a general, broad, humble request that there is an amazing opportunity here to move the needle, and there is a mechanism to participate for private hospitals and set the bar high.
Got it. Thank you very much. I think your point on how NABH should aspire to be at the leading edge at the frontier of innovation and the ability to be able to define what is gold standard data, I think is very relevant. So I didn't want this session to be about only around digital and only about data, but it seems like that is the common thread that is binding. I think there's also a little bit of a selection bias in terms of the folks we have on the panel. But even keeping that aside, I think it is true that everybody in the room recognizes that the importance of data in healthcare is going to become, it's already very important, going to become even more and more important. And if I can sort of generalize the comments here around the different things. So, we had one of the panelists talk about how NABH can create a whole marketplace around digital, which can foster, companies to do better and be able to benchmark. Then there was a whole discussion around how do we create a better, what is the role that NABH can play in creating a startup ecosystem where, we can get startups to make it easier for new age companies to come and thrive because of the guidance, as well as in some ways the promotion that NABH could provide them. And there was a whole discussion and comments around how in many areas, building India-centric benchmarks or India-centric standards, NABH is collecting so much information or should collect information in very critical areas to be able to say that, okay, here is what is sort of the current state in specific areas of performance in the industry, and here are sort of very specific benchmarks. So we can actually start to play a much more proactive role, not only in defining the processes, but also sharing with all our stakeholders what are the different levels of benchmarks, and be able to then support that. We also heard about how the role of NABH from a patient safety perspective, and then the final comments around innovation. So I'm just going to go around. I know we have a lot of stuff before we get to dinner, so I don't want to delay this panel anymore. One final comment from each of the panelists, and then we will wrap this up. So I'll pass it on to you, Dr. Rao. Any final comments from your end, and then we'll, again, just keep it to just one or two sentences if you can, and we can take it.
Yeah, when we want to make uniformly the entire country follow same thing, I think it is the digital platform, and associated with that, we need to be able to get the inputs from the healthcare providers. When I started in 1999 to go for any certification, at that time it was not there, it was only ISO certificate. Then I thought that it was the Kaizen is the one. The Japanese guys used to follow Kaizen. Kaizen means that the bottom people who will able to create more value rather than the top side. So if you're able to take the inputs from all the healthcare providers and give it to the NABH, NABH is the central point where totally entire healthcare in the country can able to go on much better. As other panel member has suggested, then different hospitals, different states, the entire thing is different. Then the quality will not come, and the patient safety is also not there. So the training and all the human resources and all the services, and then combined all those things, then we can achieve one of the best.
All right, thank you very much. Dr. C.B. Rao, yes. Final comments.
Dr. Bhaskar has brought up one very nice and correct point about the infrastructure and the space. One thing which we can find in India, common across the hospital, is the constraint of space. So, and governments have to do something, I believe, to make generous availability of space. We can't have a situation where malls have got multiple thousands of square feet for shopping, but hospitals are starved of space. We should have something. Thousands of acres for software centers, automobile factories, engineering companies, but hospitals have to make do with very little. Okay, vertical growth is one option, but then really hospitals must be taken as the priority sector for getting the whole space. And in this, probably NABH can contribute that if these kinds of standards have to be followed in the design of hospital with all its functionalities, this is the kind of space that is required for different types of hospitals, and then advocate with the governments to make sure that that kind of transformation happens in terms of space allocation. And of course, along with that, processes which he mentioned, the moment you improve the processes, then the antimicrobial resistance, all those issues. ICML has come out with a paper which said that the microbe situation in 21 top hospitals has been escalating, and the sensitivity of even the ICU level antibiotics is declining, which is a grim portent for everyone. But that will improve along with the practices when the right infrastructure, right processes are there. So with these humble suggestions.
Thank you very much. Hema ma'am.
My take would be, to make ours as a developed nation by 2047, which is the mission for all of us are also striving. India has to be a healthy country. We have best of the innovations, the best of the inventions available, the best of IT brains here, the best of medical brains here. So when the system is so conducive, what's stopping us? So probably scaling is what is stopping us. And maybe we would have to also encourage and encash the government's intervention here, where there are beautiful schemes laid down by the central ministry. How do we make benefit of all these 4 parameters and take it to the last mile? Because I fairly and strongly feel that the last mile connection is still strongly and mostly missing.
All right, thank you very much. Yeah, Vaibhav.
My request will be, for you to start a sort of a new age subcommittee in NABH, where all the startups can get enrolled, and under the guidance of NABH, the standard code of conduct can be laid in, also giving them enough space to continue to experiment, and I think the moment they say that we are under the guidance of NABH, a lot of problems get solved for them automatically.
Perfect. Thank you very much. Ravinder?
Yeah, so as somebody said that, the healthcare is very personal. If you go to an oncologist today, you'll actually see at the end of the diagnosis, they'll print NCCN guideline and give it to you. And that comes from the US website. 5 years down the line, I would like to see that one coming from India. Yeah. That's the vision I would say that we should have for
Aditya.
Yes. So as an HIS and EMR provider, we are obviously, I'm very excited about the standards that were released today. I think NABH can be a guiding light to both sides. You know, a lot of times there's self-doubt from our side that what we are providing, is it something the hospitals want? And there's always gaps, and hopefully these gaps will now keep reducing as we follow these standards and ensure it's a win-win situation for everyone. Thank you.
Raghu.
Yeah. Quality, excellence, innovation, right? So I'll just end with an open call to everyone to collaborate with us through NABH in essentially creating really the next generation of data wealth, right? Because that's what is going to make us a healthy country, and that's what is going to yield us economic reforms, economic yields.
Yeah, wonderful. I think those were great ending words, and I couldn't concur more with all the panelists that NABH is just in an absolutely fabulous position to be able to lead the way, not in only in the traditional stuff that it does, but even in the new age stuff, whether it's data, whether it's analytics, whether it's AI, because the kind of connectivity that it has to 20,000 healthcare facilities across the country today and growing, and now with the ability of each of those 20,000 entities to be able to start to collect more structured healthcare information, I think we're all collectively sitting on a gold mine. So look forward to some amazing years ahead, and thank you very much to all of you all on being so patient listeners to us today. Yeah.
Thank you very much, sir. And I will invite Dr. Rizwan Koita. Yes, our Secretary General, Shri Kannan Sahib is here. So both will be coming on a stage and will be felicitating, presenting a memento to all the panelists in this session. Dr. B. Bhaskar Rao, आप सभी की तालियों के साथ हम इनको थैंक्स कहना चाहते हैं. इतना लंबा अनुभव है, इतना कुछ कंट्रीब्यूट किया है, still he is very enthusiastic and energetic and always ready to contribute for such projects and programs and events. Thank you very much, Dr. B. Bhaskar Rao. Then we have Dr. C. B. Rao, who has more than 50 years of experience and has led Pfizer Healthcare India and is a prolific author. He has written almost 16 books on this subject. Then we have Hemgauri Bhandari ji, our advisor, Chief Advisor to the Quality Council of India, with extensive experience from the roles at Prebo Automotive and Bosch. With a background in engineering and management, she plays a very important role in advancing quality standards and regulatory frameworks at QCI. We also have with us Dr. Vaibhav Kapoor, co-founder of Pristyn Care, who has driven the growth of the $1.4 billion healthcare startup, and award-winning surgeon. Then Mr. Ravinder Singh ji, who is Senior Vice President and Head of Consulting at CitiusTech and brings 27 years of expertise in healthcare technology. Then Mr. Aditya Patkar Sahab, he is co-founder and CEO of Plus 91 with more than 15 years of experience in the field, and Raghu Dharmaraju, CEO of ArtPark, spearheads AI-driven initiatives for health, climate and agriculture, earning accolades like Global Grand Challenge on Equitable Artificial Intelligence. We are grateful to all these panelists who contributed, participated in this special session. Navodaya, NABH, leading the way in the healthcare innovation, ladies and gentlemen. Thank you very much, sir. And of course, Shri Rizwan Koita, sir, who is Chairperson of NABH. Under his leadership, this NABH event, this is very prestigious, very important event which is being organized under his leadership as he is the chairman of NABH. Thank you, Rizwan Sahab. Thank you very much. And thanks सभी का जिन्होंने जिस रूप में भी इस पर contribute किया है. Thank you so much. और इसके बाद एक just we will have a 5 minutes break to change the setup of the stage, and then we will have one session. उसमें जो फेलिसिटेशन है हमारे चैम्पियंस हैं NABH डिजिटल हेल्थ स्टैंडर्ड्स के, जिसके बारे में डॉक्टर अतुल मोहन कोचर ने पहले जिक्र किया, उनको आज यहाँ फेलिसिटेट किया जाएगा, उनको सर्टिफिकेट्स दिए जाएंगे उनके इस अचीवमेंट के लिए, और साथ ही उनको ऑनर किया जाएगा. जस्ट 2-3 मिनट्स आपसे चाहिए, उसके बाद हम उस सेशन की शुरुआत करेंगे.